Assalamu alaikum. My name is Mohammed Tawseef. I am a diabetes specialist podiatrist in Sandwell and West Birmingham Hospital Trust in Birmingham. I have visited Pakistan recently, where I've actually found that the prevalence of diabetes and its amputation rate has been very high. Patients have been suffering with diabetes-related problems. They don't have the awareness to care for their feet and diabetes as a condition itself. We have formed an international podiatric medical association which aims to promote health education in Pakistan, save diabetic feet in Pakistan, and promotes the podiatry in Pakistan, where we can actually educate patients. We have done 2 camps, and both camps have been overwhelmingly popular, where we had over 500 patients coming to see us. Most of the patients came from very rural areas where they don't have the finances and the education and the understanding condition. So, hence, what we found is that there has been many patients who are not aware that they are diabetics. Many patients who are not aware that they need to manage their condition with appropriate medication. Many patients who are not aware that they need to take cautionary measures. One of the trends which I've noticed here is that patients' diabetes has been incredibly high. We have found several observations. We have found several patients which are neuropathic. We have provided them with education. We have provided them with the treatment. If there has been any problem, we have seen several patients with ulcerations, which has been treated and referred to the appropriate hospitals or healthcare authorities, where they will be able to continue with the care. One of the saddest things which I've noticed is that people don't have enough resources to be able to afford the medication. And that has been the main problems which I've seen. These camps have given us the hope, and these camps have given us the understanding what is needed in Pakistan and how we can actually improve that. So me and my team, we're going to go back to England. We're going to map out problems which we've actually seen in Pakistan and try to come back on annual basis to be able to and address the issues that we've actually faced today.
My name's Abid Hussain. I've been a podiatrist for 23 years, always had a passion of taking care of feet as well as diabetic feet. I was approached by Aisha and a couple of my colleagues to come to Pakistan to take care of diabetic feet. And it really got me thinking about diabetic feet. Diabetes in general is a worldwide problem. There's 450 million diabetics in the entire world, and that's been growing at an exponential rate. It was 108 million in the 1980s. It's grown quite a bit. Every 30 seconds there's an amputation in the world because of diabetes. We know in Pakistan there's approximately 35.3 million, and but we don't know for sure how many diabetics there are, because there's no centralized database regarding diabetes within Pakistan. We know 150,000 people have their foot amputated every year. That's such a large number, and this is from problems that can be easily prevented rather. So I was approached by Aisha and a couple of my colleagues to come here, and I really wanted to make sure that this would be a more comprehensive treatment and comprehensive plan that we had in place, rather than just coming for a few camps. So we need to, while we have been here, we've seen 400 diabetic patients. We've seen many patients who did not know they had diabetes. We've seen other patients whose diabetes was out of control. So we've given a lot of advice. We've also treated ulcers. We've also found a case of osteomyelitis, which we have sent on to the appropriate referral pathway. We've all got a passion to try and reduce the number of amputations that are occurring here in Pakistan. We realize that we need to do more camps within Pakistan. We need to come back to Pakistan with other UK trained podiatrists. We need a group of at least 10 to 15 podiatrists at a minimum to do a vast number of camps and treat a few thousand people rather than a few hundred people. However, we realize that we need to train existing healthcare professionals and also train new diabetic foot care assistants. So we've created a training program for diabetic foot care assistants, as well as medics and nurses within Pakistan, which we hope to implement. We've had some really good feedback from a few diabetic hospitals, and it's something that I have so much passion towards, because this will be something lasting, and this will enable the existing infrastructure, healthcare infrastructure, to be able to screen and treat diabetic foot conditions appropriately. There are no trained podiatrists in the whole of Pakistan. You can imagine that there's 200 million people. There's no trained podiatrists in the whole of Pakistan. People do a 1-week course and then they try and treat a diabetic foot ulceration, or they try and give some advice regarding diabetes. There is no public health awareness campaign within Pakistan regarding diabetes and foot care. Now, all four of us have an enormous amount of passion towards this, which is why we created the International Podiatric Medical Association. But we need more people, we need more help. We need help from podiatrists, we need help from government health officials, we need help to be able to make a lasting difference within Pakistan. They do not have the infrastructure that we have in the UK, which is an amazing infrastructure. We need to help the government of Pakistan to create that awareness campaign, create the Feet First campaign, create the infrastructure that is required, which is what we inshallah will try and do. So I will request two things. I would request the Pakistani government to try and help us as much as possible, and I would request that any UK podiatrists who are listening to this, who can spare a week or two every year to come out and help us. It is an interesting experience, but it is also a rewarding experience also.
Hi, my name's Aisha. I'm a diabetes specialist podiatrist. I was the first qualified podiatrist to come to Pakistan and work. I realized within first 6 weeks, I realized how important it was for us to bring podiatry in Pakistan, especially in regards to diabetic foot care. I started working and started seeing patients on a daily basis. I was questioned by doctors, nurses, physios as to what podiatry is. It was almost non-existent in Pakistan. Nobody had ever heard the name podiatry. I probably met 4 people in the first year who knew what podiatrists do and what podiatry is. I realized that I had to do something and I had to bring a change. I had to give something back to my country. I went back to England. I started speaking to my colleagues, started speaking to my friends who studied podiatry with me, and started explaining how much podiatry is needed in Pakistan, especially in regards to diabetes and the complications associated with that. I knew it was going to be challenging. I knew I would face a lot of resistance. I knew I would have a lot of hurdles, but I also knew that I was not going to give up. I've taken the first baby step. 4 podiatrists in England agreed on coming back to Pakistan with me for a week. And what we've done in this 1 week is carried out camps in numerous towns and villages. We have seen over 500 patients, and about 80% of the patients had poorly controlled diabetes, and the 20 to 30% of patients didn't even realize that they had diabetes, didn't even know that they had diabetes. So we diagnosed about 30% of new patients with diabetes, and they were shocked. What we also found was that about 60% of those patients had some sort of foot problems. As soon as they came in, the first thing they said was that our feet feel really numb. We get burning sensation in our feet at night. So what we really need to do is bring more podiatrists on board and do something for Pakistan. I know it's a developing country and we will face a lot of hurdles, but I think it's worth it. Even what I said to myself before coming to Pakistan this time around was, even if I can make a difference to 2 people in 1 week, it would definitely be worth it. Now that we've taken this baby step and we've had such an overwhelming response, more podiatrists would like to join us, and we would welcome all the podiatrists from all different specialities to join us and help us make a difference and save diabetic feet in Pakistan.
Hello, my name is Osama. I'm one of the podiatrists here at the International Podiatric Medical Association. Having recently qualified from the University of Northampton, a few months back the team and I decided to head back to Pakistan with the idea of saving diabetic feet here in Pakistan. We conducted 2 completely free of charge camps here in Gujarat and Gujranwala, and having done a huge PR campaign, we had a fantastic turnout, and we saw in the region about 400 to 500 people across the 2 days between the 4 of us. It was a completely eye-opening experience with many patients not knowing what diabetes is, the effect it can have on the lower limb. Many patients came to us with no idea how diabetes affects their lower limb, no idea what glucose control is, and how it can affect their feet and ankles if left untreated. Over the course of 2 days here in Gujarat and Gujranwala, the team and I screened hundreds of patients, having conducted vascular and neurological examinations on them all. And what we found was many patients were unaware that they were diabetic or they had diabetes. What we found was that many patients weren't aware that they had diabetes. A lot of the time was spent on education and screening the patients, and to ensure that they knew what they could do for themselves once they've been diagnosed with diabetes. The vision and the idea behind it all is to create further awareness of podiatry to a country that has absolutely no idea. The idea behind it all is to create further awareness for podiatry in Pakistan, in a country that has no idea what podiatry is, what podiatric intervention is, and how podiatry can help save the lower limbs. The rate of amputation is sky high in Pakistan, with the World Health Organization claiming that someone somewhere in the world has a below-knee amputation every 30 seconds, and the team and I are doing our bit to save lives. Furthermore, we're also aware of the mortality rate post-amputation. The chance of that patient surviving 5 years post-amputation is less than 20%. The experience has broadened my horizons and has provided a fantastic insight into the challenges that occur when diabetes is left. The experience has been eye-opening and thought-provoking, and has provided the team and I insight into what can happen when diabetes is left untreated. Having seen over 400 patients over the course of 2 days between the 4 of us, it was clear that the scope of practice here in Pakistan is very, very high. Many patients don't know what diabetes is or how it can affect their lower limb. The idea behind the International Podiatric Medical Association, or the IPMA, is to create further awareness of podiatry in Pakistan. And it is our vision that many other podiatrists from across the world, of all backgrounds, races and ethnicities, will be willing to come to Pakistan to save diabetic feet. Since starting the camps and our social media marketing, we have received hundreds of emails from all podiatrists from across the region asking how they could be involved. It is something we are actively working on, and we are hoping to bring back a number of podiatrists to join us to help save diabetic feet in Pakistan. We realise that between the 4 of us we can't treat the entire country, and therefore we are asking for your help to join us and help us save as many limbs as we possibly can here in Pakistan.
अस्सलामुअलैकुम वरहमतुल्लाहि वबरकातुहू। डॉक्टर साहब इंग्लैंड तो आए ने, बड़े अच्छी फील्ड में, बड़े अच्छे ने, बड़े प्यार ना चेक करते ने। मैं भी आया हूँ, चेक कराया, मैंने शुगर जी है तकरीबन 200 तक उठाई है, तो उन्होंने दवाई भी दी है, चेक भी किया ने।
खुशी हुई है नेशनल फर्नीचर वाले ने ये जो कैंप लगाया फ्री शुगर फ्री कैंप बहुत अच्छा है, डॉक्टर बहुत अच्छे ने, बहुत अच्छे तरीके से चेक ना किया है, बड़ी खुशी हुई है। ऐसा कोई इतने गुजरात पाकिस्तान कोई डॉक्टर से चेक नहीं करता कि जिसने तो सही ना उन्हें चेक किया है, इन्हों की मेहरबानी है। और बहुत अच्छे डॉक्टर ने अपने को दवाई भी देंगे ने, बहुत अच्छे तरीके से चेक करते हैं।